Today's episode is about signs and symptoms and how to use them to create better health in our dogs. Hi everyone, welcome to Dog Happy. I'm Missy. Today's guest is Dr. Jeff Feinman. Dr. Jeff graduated from the University of Pennsylvania with degrees in not only veterinary medicine, but also molecular biology. He is also the Chief Empowerment Officer for HA, which is Holistic Actions, and we will talk more about that group later on in this episode. He was also the first veterinary homeopath in Connecticut. Thank you so much for being here, Dr. Jeff. I'm really excited about today's episode. How are you?
I'm doing great, and I really appreciate being here as well. So thank you, Missy, and this will be so much fun.
I think so too. So today we're going to be talking about the holistic decision-making format that you have promoted at Holistic Actions. And can you tell me a little bit more about that?
Holistic medical decision-making is the same method that we all use to make a decision to buy a TV or buy a fridge or or do anything, but it's applied to our animals. So it's designed to allow a lot of information to be put into a format that's easy to use and reproducible and teachable, where the first step is, choose a goal. So choosing a goal is knowing, is this an emergency? Do I need to go to the vet right away? Do I just need to get rid of trigger foods, or is there an underlying process? Just what is your goal? Is your goal to get rid of the symptom, or is your goal to promote underlying health? And then second step, which is research. Look at everything that's out there. Third step is implementing your holistic actions so you can decide what to do to help your pets.
And how did you come up with this method?
Over time, over decades and decades of just observation and putting together a lot of different sources, the academic medicine, observation of patients, and economics as well, which, where medical or where decision-making is very, very important.
So they don't teach you this in veterinary school?
They don't, but maybe someday they will.
Right. Well, I remember when I first came across this, I'm a member of Holistic Actions, which is wonderful, and we will talk more about that a little bit later in the show. But where I first really deep dove into this whole concept of symptoms and signs and how to create better health was through one of your webinars. And I remember thinking, anybody who has dogs has been practicing this, but it was really interesting to see it all kind of come together in a measurable and applicable manner. And I was thinking to myself, I've been doing this for years. I just didn't know, I didn't have a name for it. And then I think the other thing that I really found surprising is where you had mentioned that we use symptoms, that we don't necessarily want to eliminate them right away. And I feel like, especially now with take this pill and this will be gone, or take this over-the-counter medication and all your symptoms will be alleviated. It's kind of a mindset that we have right now. So I'd really love for you to share more about how we should be viewing symptoms and to create better health in our dogs.
Awesome. That'd be great. That's one of my favorite subjects.
So do you want to talk a little bit about BEAM and what that stands for?
Sure. BEAM is the center piece of what we try to get everyone to understand. BEAM is an acronym for behavior, energy, appetite, and mood of your dog or cat or any being. And those are the symptoms that directly correlate with quality of life and internal balance and energy of the individual. So no matter what symptom you see, if BEAM is still good or normal or even better, the individual symptom may not really be anything to worry about. But again, it has to all be put in context, but the context begins with beam.
So when you look at context in the relationship to, let's take the B in beam for behavior, what would we be looking for in that instance for behavior?
Great question. Well, first of all, let me just start by saying, because I love the quote, and I'm going to mess it up, but basically, that give people a light and they will find the way. And beam is the light that you can shine on better health. And yeah, frequently the very first signs that something is going on with your animal is behaviorally. And a great example is, a dog that starts isolating in the corner or reacting to every noise or acting fearful, any behavior change. The key is change. You've got your normal behavior and all of a sudden something changes.
And then with the E for energy, how do you define energy?
Also a great question. And you can think about energy in a lot of different ways. Electricity is energy. Gas in the car is energy. There's the mystical energy of the universe. There's the energy of the individual. For our purposes, we're talking mainly about cellular energy, which is the energy that the body needs to do its job.
Okay. So are you talking about when we look at energy as a symptom, are you talking about looking at like maybe the dog's digestion starts to slow down, or are you kind of also looking at it as I had come across somebody who explained it once pretty well, to know when you have a drop in energy is that kind of dip that you feel right as you start to get tired. That's kind of a way to feel your energy move, or right before you start to get a cold. It's not that you're full on sick at that point. You just kind of feel like a change in your overall your energy, right? Your beam. Yes, that's exactly right. Your beam.
And that's exactly how disease begins. You have that sensation that we as people can express, that I feel like a cold is coming on. But a dog, it might be he doesn't want to get up, he doesn't get up at his usual time, or he doesn't greet you at the door, or he walks slower on the walk, or just some physical manifestation of that energy being lower.
Oh, that's excellent. And then the A is appetite, which I think most people would get, but if you could dive into that a little deeper, that'd be helpful.
Sure, that'd be awesome. Appetite is more than just, my dog or cat is eating, his food real well. Is he eating everything that he ordinarily would eat? Is he eating as quickly as usual? Is she, waiting for her food? The way Sue knew her dog Rain was having a problem at the beginning was she stopped the what did she call it? The hurry up. She's preparing the food, and Rain typically barks, in excitement for the food, and she wasn't really doing that, and eating a little bit slower and starting to get a little picky, and all those things relate directly to the A in the beam. And they'll tell you something's going on.
And when you say your dog is starting that, so you just recommend maybe, I'm sure this is my biggest weakness. I do not journal. I should write all of my dog's symptoms down. I keep thinking I'm going to remember them for the rest of my life, and then somebody asks me details and I'm all jumbled. So everybody who's listening, get a journal. Whether it's a notebook or not, just write down some things, even if it's just 2 or 3 thoughts, because you might start with any of the acronym. So you could start with appetite changes, which don't mean anything in that moment, right? Other than pay attention Is that what you would suggest then?
That's perfect. That's exactly right. If your beam is fine in all ways, but the appetite's a little bit off, maybe for a meal or two, but the rest of the beam is fine, then if you're super cautious, you go to the vet and they can rule out, any physical changes. Depends on your motivation for finding out if there is any underlying issue. But yeah, it's often the very first clue that something is off is, it's starting to get a little bit pickier, or maybe eat a little bit less, or leaving a few bites in the bowl.
Oh, wow. And then the last one, the M, is mood. How would mood differ from behavior?
They can be, or we can be in a bad negative mood, but have normal behavior. But yeah, if a dog is, depressed or anxious, or, they may or may not manifest that in their behavior, but you can often tell by, we know our dogs very well. I mean, well, I'm just gonna show you Archie all curled up here, and but yeah, so it's often the first sense that something's off.
Yeah, my dog, Batman, had or has thyroid issues. And one of the first signs that the thyroid medication was working was he would join us more often. So, I think when you said that, that really kind of clicked for me, that there wasn't a change in whether he was a nice dog or a mean dog, but there was this willingness in behavior to come and join us, because I guess his mood was a little bit elevated because he was starting to feel better as the medication started to take effect. And that's really helpful.
And his energy was better because the thyroid drives the whole body, right? Exactly.
Yeah.
That's a great example.
Yeah, I forgot about that. So after we go into BEAM, there were 4 P's that you were talking about in the literature. Can you talk a little bit more about those?
Only if you'll let me talk a little bit first about why it matters.
Yes, absolutely.
Okay. And that is, it matters so much because symptoms are clues to what's going on internally. The things that you see going on, like BEAM or vomiting or diarrhea or itching or red ears, those symptoms are clues that something is off internally. You may go to the vet and they find nothing wrong whatsoever, but that doesn't mean that there's not still something going on internally that you can improve. And we'll talk a bit about how you can do that. But the 4 Ps were just a way to focus on symptoms, or a way to think about symptoms that are the most significant. So symptoms are clues. The most significant symptoms are BEAM, and any symptom that lasts a long time, any symptom that's causing a problem, any symptom that is odd. And the 4 Ps stand for, is it persistent? So one-off vomiting is not the same as vomiting over and over again for days on end. Is it problematic? Is the symptom actually causing a problem for your pet? Or it's like they vomited and it's like, it's no big deal. So particular symptom may or may not be problematic for the pet. Prominent is the 3rd P, and that is the more obvious, the more dramatic a symptom is, the more prominent it is. And peculiar is just another P that describes significant symptoms, especially if they persist, or they're problematic, or they're prominent.
So the foundation is BEAM then. So BEAM is what we should be every once in a while just taking a look at our dog and maybe writing down how we feel like they are in each of those categories. And then the 4Ps, or well, I guess you have 6 now because you have perseverance and patience. Let me go back over them. They're prominent symptoms, problematic symptoms, persistent symptoms, peculiar oh my gosh, peculiar symptoms, and then you've got perseverance and patience, but that's a little bit with how we should be behaving towards the symptoms is just kind of stick with it. Because like you said, some of this, we are so in tune to our dogs that we see things that are changing with them well before anything physically measurable with current testing can be tested, I guess, for lack of a better word. That's the beauty of loving dogs, and also a little bit of the heartache is that you can see it before you can find a test for it. But those 4Ps, they actually go back to the BEAM. So we take each of the symptoms or anything that we see that might be out of the ordinary within the BEAM structure, and then we take those 4Ps and we kind of maybe classify them a little bit more. I had heard that you had said that symptoms should not be eliminated right away because they are a clue to what's happening inside of a dog. So how do I know when I want to eliminate a symptom right away, or if it's something that might take a little bit longer and that's okay?
Great question, because it all goes back to a P. Is it problematic? Okay. The more problematic it is, the more you may want to soothe the symptom. Notice we're not getting rid of the symptom, because getting rid of the symptom eliminates your clue. It's like that detective in the Agatha Christie, touch nothing, clues to a crime, don't touch the clues. Because the clues are what allow you to figure out what's going on internally.
So say I have a dog who has an ear infection, and right now I could just treat their ears with ear medication. Will that, sometimes you hear when you hear about holistic, you hear, well, that could drive the problem deeper. But my dog has an ear infection, and it's painful. How do you balance what you want your outcome to be, which is part of the HMDM, which is that goal? What is my goal? The health of my dog, with this symptom that is causing a problem?
I guess we'll have to go back to problematic. How problematic, how persistent, how prominent is the symptom. But if it's, let's say, an ear infection, is a great example, because number one, is it an infection? Is it yeast or bacteria, or is it the body showing that something's going on internally? And the bacteria and the yeast that live on our bodies, on our dog's bodies, 24/7, all the time, it's there. They're being allowed to cause or trigger a problem in the ear. So what do you do about that symptom? You try and make your dog comfortable by using soothing, holistic, methods which work with the body. Because that's really the key, Missy, is working with the body versus working against the body. If you soothe the symptom and at the same time treat the underlying disease, you're working with the body until it gets better. If you eliminate the symptom and don't do anything with the chronic disease or with the underlying cause, that underlying cause is going to gradually get worse and worse and worse. That's what you're calling driving it deeper, because the symptom may go away, but you may end up with liver disease or kidney disease or some internal, more serious problem.
So if your dog, say my dog gets an ear infection, so this one time I go to the vet, they determine that it's bacteria, we treat it. But now 2 months down the road, it's come back again. That should kind of become an early warning sign, which is also part of this decision-making process, and we'll go there in a second. But that would be considered an early warning sign, even more so than the initial ear infection. I treated it, now it's come back. Now I need to do what? Look at what I'm feeding the dog, look at the general vitality of the dog, start to take maybe a step back and say that this is vitality dropping. If that ear infection is back, there's something that's not allowing the body to go back to balance, right?
Or my interpretation would be that the fact that the ear infection came back is a super good sign, because that's a clue that the body is saying to you, look, pay attention to this symptom. I'd really rather not make it more serious, but if you suppress it again, I may end up with allergies that last for the rest of my life, and I'm sorry. You should have let the ear infection, get soothed while you treated the underlying disease.
Oh, wow. Okay. Sometimes you get stuck, in your journey to better health. You kind of try and balance, what can I take care of right away and what don't I? But I think the point that you just made is absolutely wonderful, that it is more of a red flag if it came back, that you need to really take a hard look. Don't keep going down the same road, because what you just didn't work. So you need to really step back and take a look at it. Are there other early warning signs that maybe we think of as normal dog symptoms?
Well, I mean, that's a fantastic question, because you are raising the common versus normal topic. And common symptoms are usually or often not normal, because they're signs that a lot of dogs have, so they're common. But if, there's eye discharge or itchiness or dandruff or a little reflux or, this or that you go to the vet and the vet says, oh, don't worry about it. It's, nothing. It's normal for dogs. Frequently, those things are common, but not normal. So for example, the ear that becomes red and cookie and, inflamed may have the common but abnormal symptom of this ear is a little pink. Maybe it's pinker than the other ear, or it's pinker than usual, pinker than other dogs. And that's the best way to see your early warning signs. It's if you have two dogs and one has it and one doesn't.
Yeah, and actually that's something that I don't think a lot of us think about. Some of us think early warning signs have to be these big moments like an ear infection, but that your dog's ears might be a little more red. Maybe they have a little bit of eye discharge. So what do you do in that context? Do you just step back and say, I'm just going to write this down and I'm going to keep an eye on it and see if it progresses? Or do you take a look and say, are there some foundational things that you can improve if you start to see little tiny things like this?
Well, the number one thing is diet, for sure. But now, to really answer the question, we're jumping ahead to what are the holistic actions that you can take and why do they do what they do. But in general, the first thing that everyone can do right now is look at their dog or cat's diet, their dog's diet, as far as the vitality. You've mentioned the vitality a couple of times, and I love that you're using the word because vitality is the energy that the body needs to have a good life, that your dog needs to have a good life. So, and fresh food versus commercial food has a much higher vitality level. It's more vital. It's more real. It's more alive. Commercial ultra-processed food is enough to sustain, and often maintain a dog, but frequently dogs on commercial foods and low vitality foods will have a lot of the early warning signs: smelly skin, recurrent ear infections, recurrent allergic symptoms, and the only thing that you need to do is raise the vitality level by giving a better diet. And you don't need to switch to all fresh food or raw food. You could even just add in up to 25% of a real food in with the dry food. And one more little tip is that canned food, which is a little bit more meat-based rather than carbohydrate-based, canned food is a little bit higher up on the vitality scale even before fresh food. So sometimes even just switching to a canned food or more canned food is going to help. But fresh food helps the most. And, do I get to put a plug in for the blueberry kale smoothie? Because the blueberry kale smoothie is saved a lot of dogs from allergic and ear problems without having to switch them to a fresh food. And that's just wild blueberries, fresh blueberries, and kale that's been chopped up and all blenderized into one beautiful bluish liquid that you add to the food, and that will often be enough to provide the raw materials that your dog needs to heal.
So because you opened that door, I just wanted to ask, so dogs are carnivores, and I'm feeding kibble, which tends to be a little higher in carbohydrate so that they can extrude it and make the form. So if you're adding blueberries and kale, aren't you adding more carbohydrates? What would be the benefit of adding, if you were feeding kibble and you're going to do that 25%, should I do a blueberry kale smoothie, or should I do some turkey or some eggs or something like that?
I would start, that's a great question, and it's not just a little bit. You're talking about 10% versus 40 or 50% in dry food. And they need that dry, those carbohydrates to make it a dry food, to extrude it. I would start with just adding fresh. Before this problem, start to add a little fresh food or transition totally to fresh food. But if there is an allergic problem, because actually ear infections are, one of the signs of the allergies of allergic imbalance or immune imbalance, I would go right to the blueberry kale smoothie because of the antioxidants. One of the reasons that we use those two things together is the antioxidant profile is super for supporting allergies.
Oh, great. So it's not really a supplement to the food. It's more of like a little vitamin and mineral supplement instead. Yeah. And I think if people, again, creating that context that you were talking about, think about food in the context of themselves. If you're eating boxed macaroni and cheese and processed this and that, your vitality is going to be much lower than if you're taking the time to prepare home cooked meals, better balance over time. And in truth, there's not much difference for our pets. So, okay. So if my dog's balance is down and I'm feeding kibble, then that's definitely a first step. Now, is that also like the helpful determining step if I've already been feeding a fresh food diet, yet this ear problem keeps coming back? Do you feel like that would then be my indication that maybe I need to go to a homeopathic doctor, a chiropractor, an acupuncture? I need to do next level exploration, right?
You're talking about, taking the next step, and the next step is going to be, with some of the practices based on the energy, the fuel in the body, the ability of the body to heal itself. Because one thing we know for sure is the body, your dog's body, is built to heal itself. Symptoms are a clue to what's going on with that healing, and then we can take the next step with fresh food and other actions, very specific actions that you can do at home or do with the practitioner that raise that energy level that will help your animal be healthier overall. And then symptoms tend to resolve as the body gets healthier internally.
Yeah, I don't think I realized until we were just talking now that mange, it's the Demodex mange, is an immune mange. Some stressor has happened and the system has gone down, and it's just, the bugs that live on a dog's skin have gone overboard. And sometimes you think about mange as this giant issue, but your ear infection is just as large of an issue. It's just in two different spots, because I hadn't really thought about it in that context. While I'm holistic, I'm also I try and, integrate more than pick one or the other. And I think in that terms, bacteria gone, yeast gone,
And I'm just going to stop you right there, because you need to integrate. It's all about, holistic is all about connecting everything. All of these schools of thought are little pieces. We now focus on molecular mechanisms in science and medicine, but, that makes us lose sight of the forest of overall health for the trees of cellular health. So yeah, it's not as important. It's important for everyone to integrate the best of both worlds, because that's really what holistic actions is all about, is getting the best of both worlds.
Yeah, I think that is my goal for my own health and my dog's health. And I'm always surprised at what I find, and that's kind of been out there just by taking that first step on this journey, like with the symptoms. Just understanding that symptoms are a reflection of internal health, not something isolated. They're a reflection of internal health. And then to apply these different, the beam, taking a look at the 4 Ps or 6 Ps and keeping up with that. Now, I find that health is quite a journey, and it's not just one and done. It's you will need to reevaluate beam and things of that nature on an ongoing basis, correct? It's not just this static moment, I took care of this and nothing else is going to happen, right?
And that is such a great point, because that is the key to everything, is understanding that it's not a static picture. Like a blood test is a static picture. Well, what happened last year? What happened the year before? So yeah, you definitely need to and want to be patient and persevere with your symptom, soothing, which is, the goal of all of our dog care. It's keeping them as happy and healthy as possible.
So how much of your own journey kind of guided you down this holistic pathway?
And, I started having my own problematic and prominent symptoms when I was 14. And it wasn't until I was in my 50s that I was diagnosed with a genetic brain disease that explained all the symptoms, and that this whole story and the whole journey was trying to see what works for myself. I am my biggest self-experiment, having gone through all of the steps and Lyme disease and celiac disease, and yeah. So
And you've had to persevere and persist and be patient. It's taken you 39 years, right, to get an actual diagnosis, or was that a while ago when I
well,
heard
that took a good. So it was almost 40 years. Yeah,
almost 40 years?
yeah.
Yeah, you've
I
had to be
got.
very patient.
I did have a choice.
No, no. And most people who have the journey that begins with illness generally do not have a choice. And actually this whole holistic opening in my life started with my mom. You know, she just had the rare and unusual side effects to everything, and watching all of the adjustments she's had to make in her life really opened that up. So there's always a journey. So what was the end diagnosis for you?
Uh, the end diagnosis that explained the early age paralysis, the slurring of the speech, the head tremors, the everything is something called spinocerebellar ataxia, which is a disease of the brain where a section of the brain called the cerebellum, or the balance center of the brain, is basically shrunk down. You know, it's normally like that big in mine. It's, you know, like a little mini marble. And usually the prognosis for that is, you know, 15 years or so after the diagnosis. You know, a lot of these people end up in a wheelchair or end up choking because their brain isn't controlling their muscles, you know, in the proper way. So, you know, here we are, 45 years after, you know, after symptoms first started. But I think, you know, I mean, do I have residuals? Yes, I have slurring of speech and some balance issues and other issues. But, you know, using the method that we're just talking about today for dogs is allowing me to actually have the best years of my life now when I'm in midlife at 60, expecting to live to 120, which is genetic lifespan, life expectancy of all of us is, you know, well into hundreds.
So was it this cerebral ataxia? Is that what kind of started you? I mean, how do you move from being a conventional veterinarian to integrating a holistic practice in your practice? It was this part of that driving force?
That was part of it, because I got to see the medical system for decades as it applied to myself. And what really started the whole holistic journey for me, because I was an academic, you know, veterinarian that was research oriented and very strict about following the rules, until I was seeing a client back in the, you know, early 90s who had horrible rheumatoid arthritis. And her rheumatologist suggested nothing worked for her. But her rheumatologist suggested something that I had never heard about, that at that time wasn't part of medicine, and that is fish oils.
Oh.
This smart, this was a human rheumatologist, super smart rheumatologist who read the research, that understood that, you know, omega-3 fatty acids might be helpful in reducing inflammation and autoantibodies and the symptoms of rheumatoid arthritis. And the woman was basically, you know, better than she had ever been on methotrexate, prednisone, or all the conventional drugs. So that started my exploration into things like glucosamine, chondroitin, and omegas, and all the things that when we started using it, because you probably started using them as well for your dogs back then, it was not part of the veterinary model. Now, you know, not only is it part of the veterinary model, but almost every veterinarian has Cosequin or an omega, you know, on the shelf, because they're so effective.
Yeah. It's always just one thing that opens that door in our lives. And it's just, if you're willing to take that journey, it's amazing where it will take you. I can't believe where I started, and I'm internally grateful that I actually paid attention. I mean, sometimes I'm surprised at myself that I really and truly did pay attention, that and for as early as I started on mine, just through the health of my dogs, that at 28 I paid way more attention to like self-reflection as I move through my journey. So with each of us, especially with listeners, this might be the first door that gets opened for you, and this is going to be an exciting and absolutely amazing journey. So
It
it's going
is.
to be fun.
It is. And health is exactly as you describe. Health is a journey. It's the journey to wellness and balance. And unfortunately, we are very disease or dis-ease motivated, but the idea is to be proactively preventative in our lifestyle, because all the things that we're talking about actually can help prevent as well as improve disease.
Yeah, I think what you said, proactively prevent, and also back to the integration. It's, you are your dog's advocate, and you are your own advocate. Again, there really is a blurry line between, it applies to everything, and the more that you can learn, and the broader your knowledge becomes, and that was really the goal of this podcast, is to kind of bring this knowledge to the forefront so that you can make those decisions. Do you have to change your dog's food? No. But when you now, because of listening here, hopefully, if you do have these problems and you take a look at it through the lens of BEAM and the 4Ps and all of that, you'll be better equipped. So you just have more tools in your toolbox to care not only for yourself, but for your pets. And getting that information, we've got an internet full of information, but sometimes it's extremely difficult to kind of figure out what's right, what's real, should I pay attention to it, which kind of brings me back to holistic actions. And I really wanted to talk about this because I like what you've created here.
Sure, it's my pleasure. We have about an hour or two for us to talk about it. So you've done all your research, you've got your goal. What are you going to do? What is your action going to be? And that's where holistic actions comes in, because we help you do the research, will help direct you to what is out there, what is possible, what works, and it's not bounded by the conventional veterinary model. Just like the rheumatologist who was looking outside the box by using fish oils, 20 years before anyone else did. We're trying to do that with actions that you can use at home that will actually keep your dogs as healthy and happy as they can be. And I've just got to say, because I did use the H word, happy. And again, I love that that's the name of your podcast, because happiness activates natural healing abilities in your dog. So do everything you can to make them happy. That is the one holistic action that is going to help more things than anything else. But I'm not answering your question. That's what holistic actions is about.
Yeah, no, you absolutely did. You described it very well. And I just want to recap. So you pick a goal, you do your research, and then you implement it, correct? And then you're measuring your progress through BEAM. You're deciding what symptoms need to be looked at first by the 4Ps to see if they're problematic, persistent, peculiar, and then you're putting that plan in action, and you're just using those tools to measure it as you move forward to create better health in your pets.
That's a great summary. And the only thing I would add is that those tools that you're measuring are the BEAM, are everything you see, but they're also the internal changes, because symptoms can be external or internal.
Okay.
So elevated liver enzyme or kidney enzyme, those are symptoms.
Right.
So as you're making changes, that should also all be normalizing.
Okay. It's really back to the whole, back to everything. You're seeing a raising of vitality overall.
And that is the holistic mindset.
And that's awesome, because I think foundationally that's exactly where we need to be to keep health and to just keep that idea of health in our bodies. I mean, in our minds, in our bodies too, but in our minds as a whole. So, wow, this was incredibly informative, and I really think everybody's going to be getting a ton from this. And where can people find you if they want to connect?
The best way to connect, and thank you for asking, is holisticactions.com. And there's a contact form. There's my dog Archie, Archie is with us, but he's sound asleep. Archie's on the website, and he's there to help guide you to what you can do. So how to contact us, how to find resources. Do you want the one-on-one mentoring that we do in the weekly webinars or on the forum, or are you okay just learning the basic process on your own? And that's again, holisticactions.com.
That's perfect.
It's the best place.
Yeah. Well, thank you so much for joining me today. This has been amazing. I cannot tell you how much I appreciate it. And I just can't wait to continue to learn from you. And I just thank you so much for being here.
You're so welcome, Missy. And again, as I mentioned, before we started, I'm so super appreciative to be here and to be able to get the word out. And there would be nothing better for me than if we could help a couple of pet parents to, integrate the way we're talking about. So integrate.
Hey guys, thank you so much for joining us today. If you have liked this episode, please hit the like button. If you would like to subscribe, I'd love it. So hit the subscribe button and stay happy.